Well, good afternoon, everybody, and thank you so much for joining us again on now what I believe is the fourth town hall we've had in just about 2 weeks to try to bring the Augusta University campus and Augusta Health Science, the Augusta Health System, Augusta University Health System campus up to speed on where we are and what's going on and some of the things that have occurred. We want to make sure that you stay very well informed. I'm going to be doing things a little bit differently today. I'm going to give an overview of some things at a high level that I want to cover, and then I'll be passing things over to Dr. Kaufman, who is also be joining us shortly, and then we'll hear from Katrina Kiefer on the health system side of things very shortly too. So you'll get a chance to hear from all three of us today on issues that involve the university and our health system. Again, you've heard me say just about every time I speak that Augusta University, our first and our only priority is our students and our patients. Everything we do centers around providing an outstanding educational opportunity for our students and a state-of-the-art healthcare experience and compassionate, family-centered experience for our patient. So for today's town hall, I wanted you to be able to hear from two of our administrative leaders who will help us carry out this twofold mission of education, healthcare, and in keeping with the social distancing that many of us have become almost used to. Now at this point, Dr. Gretchen Kaufman, our Provost and EVP for Academic Affairs, will be joining us shortly, live from her Somerville office in Boykin Wright Hall, and then in a few minutes after Gretchen has a chance to bring up to speed Ms. Katrina Kiefer, the Executive Vice President for Health Affairs and CEO of the AU Health System, will be joining us from her executive conference room at the Augusta University Medical Center. First, let me tell you just briefly about what Augusta University has been doing to ensure that our academic mission continues. As one of only 4 public research universities in the state, we've obviously been working very closely with the University System of Georgia to ensure that we are implementing social distancing while at the same time maintaining both our educational and our business continuity. As you probably all know by now, effective this coming Monday, March the 30th, all 26 institutions of the University System of Georgia, including Augusta University, will have moved all courses to face-to-face instruction, all courses and face-to-face instruction to online instruction. And all campus residence halls will have been closed for the remainder of the semester, with minimal exceptions for those students unable to find housing elsewhere. Over the past week or so, we have implemented a well-controlled, phased-in move-out of students living in the residence halls, and we've done this in a very orderly fashion to make sure that that our students are able to come in, get their belongings, and move out, while at the same time maintaining social distancing and limiting the number of individuals they have in any space at any one time. And this student move-out will be completed by the 29th of this month. We may have a few medical students that will be staying in until spring break, and they'll be moving out during the spring break period of time. And that was done to try to cause us a little disruption with their studies, which have continued throughout this 2-week period, and we want to make sure that they have ample opportunity to continue their studies. I want to take just a moment to give a special shout out to Dr. Susan Davies and her staff, and Dale Hartenberg and his staff for working so closely with our students and their families to help them move out and to move back home. They've been working tirelessly to make sure our students are informed, that they stay engaged, that they're safe, and that we get them back home. We will still have a small number of students that are going to be remaining in the residence halls through the end of this semester and beyond for some. And these are students who either have no home to go back to or are required to be on campus in order to fulfill their learning requirements. Our faculty, over the last couple of weeks, have been actively engaged in converting their classroom instruction to online platforms. In some exceptional cases, especially in the medical, dental, and health sciences, where some clinical skills do not readily lend themselves to online instruction, we're allowing very small groups of students to engage in clinical rotations and/or in simulated training at our high-fidelity simulation center that we have here. Again, trying to maintain social distancing even under those circumstances. For For all intents and purposes, Augusta University is open for business, but I can tell you without question, it certainly is not business as usual. We are implementing business continuity plans to limit the number of employees on campus while maintaining business operations for all the units of the university. All non-essential employees have been asked to remain home and to telework where possible. We're asking our managers to use flexible scheduling for employees whose jobs may require them to be on site, thus reducing the number of employees on campus and maintaining social distancing at all times. And I got to tell you, our managers and our employees have been very creative in terms of how to do this, how to maintain social distancing to keep our employees safe, how to allow them to telework where they possibly can from their homes, and at the same time for those employees that have to be on site to do so in a safe way. Now, we all know that there's some positions that just don't lend themselves to telework and don't lend themselves to flexible scheduling. And we are implementing a non-closure emergency leave policy that will allow us to compensate those positions for hours not worked up to the equivalent of the regularly scheduled hours. We're asking our managers to work with their respective executive vice presidents on their plans for telework, flexible scheduling, and/or non-closure leave. And we're asking all of our managers to think very carefully about this. We've presented some decision trees that will help you sort of work through this with your employees. For those employees in which the business operation and your business continuity requires somebody to be on site at all times, then let those employees work regular schedules from their on-site location, but do it in such a way as to minimize interaction and to exercise social distancing. If some of the duties can be performed at home and can be done so reasonably with little disruption to service, then let your employees telework. And we're encouraging our employees to go home and work from home. If hours need to be adjusted so that employees can do so on site, but at the same time maintaining social distancing, and there's some departments who've actually looked at the 24-hour clock, and not just how do you have employees here from 9 to 5, but how can you have some employees who may come in very early in the morning and work to mid-morning, and then another group of employees come in at that time and finish the workday, so we can maintain as few people on campus as possible. And if a combination of flex scheduling and teleworking and those sort of things are just not possible, and it's not realistic for employees to be able to telework, then they can submit requests for non-closure emergency leave to the Executive Vice President and Human Resources for review and approval, and we'll provide that. The purpose here is to make sure that our employees who their jobs just won't allow them to telework, to be able to stay at home, be safe, and yet not be financially and have financial issues because we want to make sure that they continue to receive a paycheck. Now, as you might imagine, converting a traditional campus like Augusta University or any main campus that prides itself on having an opportunity for students to physically be here, to convert that to fully online is not a trivial matter. And our faculty and staff on the university side of the house have been working diligently towards this end. I'd like to now turn things over to our provost, Dr. Gretchen Kaufman, who, as I mentioned before, will be presenting live from our Somerville campus. Now, you talk about social distancing. She's exercising about 4 miles of social distancing right now from me and from this auditorium. And she's going to give us an update on our academic mission, and I'll be back with you in just a few minutes. So, Dr. Kaufman, I'll turn things over to you.
Thank you, President Keel, and thanks to everyone joining us for this opportunity to share these updates. I'll turn first to some instruction, calendar, general academic updates, and I'll begin that by echoing President Keel's thank you. I want to acknowledge the tremendous work our faculty have done in moving our instruction to online. This is a heavy lift, and to all you faculty members, your efforts have been outstanding. Thank you. Also, big thanks are due to Drs. Zach Kelleher, Ray Whiting, and the team of 10, our college liaisons, and you know who you are, and the staff in our Center for Instruction and Innovation. This team has been working hard to assist individual faculty as well as to provide many resources about moving online at this rapid clip. And those resources are available at augusta.edu/continuity. So please visit there to take advantage of all of this that is being updated really about daily as best practices emerge. With all that in mind then, the result is that Monday, March 30th, the official restart of classes will mean we're transitioning to all online didactic instruction. To get a sense of the magnitude of that, reflect on the fact that at the beginning of this academic year, we planned for 15% of those courses to be delivered partially or totally at a distance. And Monday, with only 2 weeks' notice, we will be at 100%. This is remarkable. Thank you. Thank you. Let's go to some calendar updates. Many of you know these already, but I'll run through them quickly. Spring semester is unchanged as far as its calendar dates. We will honor all the dates there as you see them published. We will have spring break. It's still scheduled to occur April 6th through the 10th. We've had some questions, so I want to just be sure to state that faculty may not use reading day or parts of final exam week for instructions. We will honor the purpose those days were set aside for. Also, there's no extension at this point for the deadline to allow W grades rather than WFs. There's been a lot of questions, but again, for now, moving to a pass-fail grading model for letter grade courses. Any course that currently has a letter grade model is not an option. We may not assign pass-fail as an alternative to the letter grades. Sadly, for all of us, the in-person May commencement ceremony and all the attendant events around it are canceled. We would hope that means postponed. We are working to explore other potential virtual options. It's a wonderful celebration, and for all of us, not just the graduates and their families, it truly is a high point of our year, and so it is really, we're very sorry that it can't occur as we like to celebrate it, but we will be trying to come up with some different ways that we can mark that event, and certainly our students will graduate. We just won't be able to celebrate it with them in the way that we always have. Moving on, it soon will be summer. And so I want to point out that summer sessions, our summer courses, will occur. We are already planning for that as online delivery at this point. So our faculty are already working, thinking about how those courses will be delivered in an all online format. Now, turning more to students, thanks to you as well. Thank you for your understanding and flexibility. I know you'll be much more comfortable with this move to the virtual environment than any of us old people are, but still, it is a considerable disruption. So thank you for staying engaged and working with your faculty as we shift to this new delivery platform. We also know that some students have a need for technology resources. So to that end, we have a short survey that we created that we would ask those students to complete. It's on the JAGS Care website. And there's also information there about many other services and resources that are available to students. We want to serve you virtually as completely as possible, and we have a lot of ways that we can do that. So the bottom line, my message to you is we are here for you. Please take advantage of it. Thanks too, as Dr. Keel mentioned, to our students in our residence hall. You were first asked to leave, then you were asked to return, to move out for the semester. That process is proceeding very well, and the bulk of the move out will be completed, as he noted, this weekend. And that deserves a big shout out to Drs. Susan Davies and Patrice Jackson and all the Residence Life and Student Affairs staff for all that you've done to make this process as smooth as possible for our students and families, as well as all that you're doing every day on behalf of our students in or out of the residence halls. Our students will be receiving refunds of a portion of certain fees and payments. All students should have received an email describing that process and how it will occur. So this is a reminder and a plug to you students to check your email regularly. I know it's not your preferred mode of communication, but please humor us. Check email, not just for this, but for all important communications. I want to turn now to research. Another vital aspect of our research, of our mission as a comprehensive research university is research. We have outstanding faculty, staff, and students engaged in cutting-edge research across a spectrum of disciplines. As most of you then obviously know, as of Tuesday evening, we have ramped down non-essential face-to-face research. So this part of our university mission has also felt effects from the COVID-19 pandemic. Only basic care of living organisms, maintenance of cell cultures, certain human subject research, and COVID-19 specific research are continuing. With that in mind, while the actual research experience is changing, I want to make it clear that research administration, DSPA, and research-related units continue to function virtually and are available to serve our researchers. So please contact them as needed, and they will certainly aid you in every way that they can. Lastly, in terms of planning for fall, which also will be here before we know it, none of us knows at this point what the longer-term impacts of COVID-19 will be, but we are already actively engaging in planning for fall. One thing is certain: Augusta University will be here, and we will be welcoming students, new students and returning students. To that end, it's vitally important that we, the faculty and staff of AU, do everything possible to keep our current students engaged and connected to Augusta University. Students, we want you back in the fall. In fact, for that matter, consider taking some summer courses. We can meet you where you are because they will be online. In terms of our new students, I want to make it clear we are still accepting applications to admit freshmen. As many of you probably are aware, it's no longer possible for students to take the SAT or ACT exams because all of those sites and dates have closed, but that's okay. We are now authorized by the University System of Georgia to admit freshman students based on high school GPA alone, rather than in combination with a standardized test score. So please, all of you, encourage any potential applicants who may think they won't be considered or can't be now because they don't have a test score to report. Tell them to apply. We want them as part of our Jaguar Nation. The COVID-19 pandemic has caused disruption on a scale and scope not seen in generations, and it is taking a toll on every one of us, mentally, emotionally, physically. But through it all, and we will get through it, please remember, we're at a distance, but we are not apart. As many of you know, I've been here a long time at this institution, and I can say without a doubt, I have never been more proud to be part of the Augusta University community. Take care of yourself and your loved ones in the days to come. Thank you, and back to you, President Keel.
Thank you, Dr. Kaufman. Appreciate it very much. And you have been so wonderful in leading our academic mission at this institution for so long, and I know we'll continue to do a great job. She went through an awful lot of information, and let me, while I'm thinking of it, remind you that this town hall and indeed the other 3 town halls are available online. We have a YouTube site there. They go to the COVID-19 banner on the Augusta University website, and you can, if you missed a point or didn't quite understand, go back and replay the video. I also want to again thank all the staff and faculty who worked so hard to allow us to continue to provide this state-of-the-art education for our students. And 2 other things that the provost mentioned, let me just echo, and one is commencement. We are really truly heartbroken that we can't provide our students the opportunity to walk across the stage, shake my hand, and have their name read in front of their parents and family. We know that's a huge disappointment. we're going, and even though the live May commencement, as Dr. Coppin pointed out, has been canceled or postponed, we're going to try to find some way we can honor that event for you. So stay tuned. And if you have any ideas, let us know about it. We want to be as creative as we can and try to find some way that you can know how much we appreciate all the work that you've done for this very important day in your lives. And she mentioned that the summer courses, we're already making plans in the event that the summer courses are going to all be online. We don't know what the outcome of this particular pause we have is going to be or how long this is going to go. We know for sure that, that this particular semester until the end of the semester will be online. Please stay tuned, and as soon as we know what the final decision is being made system-wide about what to do for Maymester and for the summer courses, we'll let you know right away. Now let me take a minute and turn a little bit to tell you how we're carrying out our healthcare mission during this process. Being Georgia's only academic medical center and home of the Medical College of Georgia places certain responsibility on our institution to take a leadership role during this event. And our faculty, staff, and administrators in the health system side have done this admirably. It probably should go without saying, but our healthcare providers have been at the very epicenter of the COVID-19 crisis and are leading the fight against the coronavirus. We all should take great pride in the fact that AUHS not only continues to provide outstanding, compassionate health care day in and day out, but our health system and our dedicated employees are leading the charge specifically in dealing with the COVID-19 crisis. Our talented MCG faculty have developed one of the state's first and one of only a few such in-house clinical laboratory tests for COVID-19. Our dedicated staff has set up the area's first drive-through testing facility, allowing pre-screened patients to have COVID-19 testing samples collected safely and conveniently while remaining in their automobiles. And our innovative healthcare providers have launched a web-based app that provides live video telemedicine COVID-19 screening of patients. The app, also available on Apple and Android smartphones, is a one-of-a-kind tool people can use from their homes that will allow the provider, one of our physicians, nurse practitioners, or physician assistants, to interact with a concerned patient. While being initially introduced to our employees here in the CSRA and to citizens of the CSRA, just yesterday we announced that this app is now being made available to all University System of Georgia employees throughout the state, further emphasizing that the entire state of Georgia is our campus and our responsibility. This three-pronged approach of telemedicine screening, drive-through specimen collection, and in-house testing puts our healthcare system on the leading edge of technology and innovation in the fight against COVID-19. And it's my pleasure now to turn things over to Ms. Katrina Kiefer, who is now live at the AU Medical Center and has been truly leading the charge and pointing the way for all of our employees at the AU Health System to carry out that mission. And I'm going to ask her if she would provide us with an update on the healthcare mission. Katrina?
Thank you, Dr. Keel. Like the provost, I have not been here nearly as long, but I couldn't be more proud to be a part of your team, and I appreciate your leadership. I also couldn't be more proud to be a part of the Augusta University Health System at this time. I appreciate so much all of our caregivers, both clinical and non-clinical. Your compassion and your capacity to withstand changing conditions are an inspiration to me and have been to our community. Our community has continued to demonstrate an outpouring of support for our team. The hashtag #OurAUHeroes posts to social media have been so much fun. The sidewalk chalk bandits that have left inspiring images with words of encouragement and appreciation to our team members coming and going. Thank you to all of the businesses, large and small, to our faith-based organizations, to individuals, and to foundations. Thank you for reaching out. Your support is humbling. For those of you that have asked to see the names of these organizations, we are compiling them and will publish them on our website so that you may support them in turn. I appreciate our volunteer services group for coordinating these efforts. As the COVID-19 pandemic evolves, we have endeavored to remain a key resource locally. I would like to thank Dr. Philip Kuhl and Dr. Joe Vasquez for continuing to make themselves available for our campus and the media, and for their work in coordinating of messaging our approach to the delivery of care in coordination with the Department of Public Health and CDC guidance. We will continue to update our website and social media with important information from these leaders. Thank you to our elected officials for taking time to update us on your work, and especially for taking time to listen to us update you on our work within the health system community. I have been in regular communication with my local healthcare executive colleagues, as well as with healthcare leaders across Georgia and academic health center executives across the nation. We know that we have an important role to play in helping our citizens through this pandemic. At Augusta University, our screening and sample collection operations have been busy. I know that there are a lot of conversations going on about testing, and although we have made inroads to increase our testing capability, it remains limited. I can't thank the pathologists within the Medical College of Georgia and the GEM Lab enough for their expertise in leading the way forward for testing in Georgia and is serving as a resource for 82 other labs across the country. We do expect additional equipment to arrive soon for that lab, and we'll be accelerating testing within the medical center's lab as testing kits arrive in the coming days. We are thoughtfully prioritizing testing for those who need it the most. We use an algorithm to guide our testing parameters. The algorithm, currently version 18, as it evolves with the clinical information and guidance from the CDC and testing capabilities increase. As President Kiel mentioned, we have now extended our screening effort to include University Systems of Georgia community to assist in evaluating those needs for testing as well. The screenings that we have provided that lead to the need for testing to date include 3,687 hotline calls, 4,345 virtual screenings, 991 drive-up specimen collections, 30 of those at the new location at Patriots Park in Columbia County that began earlier this week, and the remaining 961 at Christenberry Fieldhouse. An additional 157 specimens were collected in the medical center's emergency department and in the adjacent tent. This has required a great deal of expertise and coordination, and I can't thank those teams enough for their efforts. Please know that the health system leadership is spending a great deal of time planning for the likely surge in patients in a way that will provide the highest quality care for all of our patients while keeping our caregivers protected. We will endeavor to keep the lines of communication open, but ask for grace as we are moving very quickly. An email is being sent to all health system users each afternoon to keep all email users in the know. A daily clinical service chiefs meeting occurs each afternoon to ensure the physician communication and to answer questions that have arisen throughout the day so that our physician leaders and their faculty are armed with the most current information going into the following morning. As it relates to the supply chain, daily we produce a dashboard that tracks supplies to include PPE, pharmacy, and lab needs. We report the number of days of inventory on hand and use a simple red, yellow, green approach to ensure that there is clear prioritization of these daily changing needs. We feel good about our supplies and pharmaceutical inventory at this time, and we truly appreciate everyone's ongoing efforts in adhering to the evolving CDC guidance on personal protective equipment, and we appreciate particularly our prescribing providers who are following our pharmacy leader recommendations related to pharmacy dispensations to extend our existing inventory and preserve resources for when the pandemic enters a new phase in this community. To our patients, thank you for your patience as we move to telemedicine options in our ambulatory settings. Thank you for understanding when your elective surgical case or procedure has been required to be pushed to a later date. Thank you for still trusting us with your care. We will get back to normal, and we really look forward to seeing you. To our caregivers, thank you for the confidence with which you enter the doors each day, and thank you for expressing concerns when you have them. Thank you for helping us make the next best decision. A number of you have submitted questions that relate to specific operational items. We are working with our clinical leadership and our infection control experts to answer all of those questions in an FAQ format. We want to do it in a way that is responsive to the varied context within our health system. We want you to have the best information for your work situation. It's 2020 and I'm talking, so most of you can guess what the next word out of my mouth will be. Accountability. Be accountable to yourself, be accountable to each other so that we can be best equipped to be accountable to our patients. Please know that you have opportunities to discuss your concerns or thoughts through the Employee Assistance Program. Additionally, pastoral care services are in-house 24 hours a day, 7 days a week for patients and staff support. That department will also be welcoming caregivers each morning and evening and will be happy to talk with you about what you may be feeling. And in continuing the virtual theme, a virtual support group has been organized and we will be getting more information to you out early next week. Thank you for the role that each of you play in the healing of our patients and addressing the wellness concerns of our community. We will get through this together. President Keel, I'll stop there. Again, thank you for your leadership, and I'll turn it back to you.
All right, Katrina, thank you so much. And she gave you a great update on what's been going on in the health system. And I got to tell you, the screening app that our folks have put in place here is truly state of the art. And if you have not downloaded the app, I encourage you to do so. In fact, as of 3/31 today, Friday, we have 4 healthcare providers that are currently available, and we have another 6 patients with providers in a waiting room, in a virtual waiting room now. So this app is operational 24 hours a day. It really does put us at the leading edge of technology during this particular crisis. So again, Katrina, thank you, and thanks to the countless numbers of doctors, nurses, advanced practice providers, pharmacists, clinical laboratorians, administrators, and staff who have dedicated their lives and their professions to the compassionate care of others. Our faculty and staff have been working tirelessly, putting in long hours to ensure that we not only maintain, but that we excel in our mission of providing an outstanding educational opportunity for our students and state-of-the-art healthcare experience for our patients, even in the face of crisis. That is what you would expect from the state's only public academic medical center, and that's what we promise to continue to do. As Katrina pointed out, many of you have asked how you can help and how you can thank our frontline employees, and she's already mentioned the hashtag #OurAUHeroes, and we hope that you'll use that on social media. It means so much to our folks here that are at the front lines of this crisis to know that you care about them. And I just want to tell you that seriously from the bottom of my heart how much I appreciate the providers and staff that are on the front lines in this fight. You are serving our community in a noble way. And we are currently working on a campaign which we will launch early next week to show the community appreciation for what you're doing. We will definitely need help from our media partners to spread the word, and our media relations team will be out in touch shortly. We want to do 2 things. We want to help the small businesses in Augusta, especially our restaurant businesses, to help them with, to keep them functional and active during this time, and at the same time allow the community to say thank you to the providers that we have here at AU Health System. So stay tuned, there will be more for that. You've heard us say thanks a lot today, and I think if we have a theme for this particular town hall, that's part of it. We have so much to be thankful for. We have an incredible staff, faculty, and administrators on the university side that even under the most unusual circumstances you can imagine are dedicating themselves to make sure we continue to provide every single student with the educational opportunity that they need to the very best of our ability to keep you on track and so that you can graduate on time. And as you've just heard, we have, without question, the most outstanding, compassionate expertise in the healthcare arena and healthcare providers who, as I've said now several times, are on the virtual front line of fighting the coronavirus. As I've said before, we are continuing to be over-prepared so that none of us will have to overreact. So thank you for being with us today. Please stay tuned. We'll do everything we can to keep you informed of any changes that come up. We hope to have these town halls in this sort of format throughout this period of time. Stay tuned. And again, let me give you the best advice that I think I can give you. Stay calm and wash your hands. Thank you very much, and go Jags.